Thank you for joining the Objective 6 Coordination of Care Through Patient Engagement webinar. This presentation is provided through a shared commitment between Access, Health Current, and Myers and Stauffer to increase participation in the Medicaid Promoting Interoperability, or PI program. A few logistic reminders. Today's webinar will be recorded and posted to the Health Current and Access website. If you have any questions, please use the chat box for questions or comments. Please include your name, your practice, organization, and do not include any confidential information such as patient health information. All lines will be muted, but again, please use the chat box. And I would like to introduce Connie Ide-Cohen as today's presenter. Connie, are you there? In that case, I would like to introduce Priscilla.
How's that better?
That's better.
How's that?
Go ahead.
Okay. Thanks, Sarah. I had a difficult time unmuting. So good afternoon, everyone, and thanks, Sarah. Priscilla Clark, as Senior Accountant with Myers & Stauffer, a certified public accounting firm specializing in federal and state Medicare and Medicaid programs, is our webinar presenter today. We're very lucky to have Priscilla. She's very knowledgeable about the subject matter today. So Priscilla, without any more ado, please proceed.
Thank you, Connie and Sarah. So everyone, thank you for joining today's webinar. Today we will be discussing coordination of care through patient engagement with a Promoting Interoperability program. Here are just some learning objectives that we will be discussing during today's call. The first one is that we want you to help you understand the coordination of care through patient engagement requirements for the Medicaid Promoting Interoperability program. We want to help you understand the differences in Objective 6 coordination of care through patient engagement between program year 2018 and 2019. We also want to help you learn about the coordination of care through patient engagement documentation requirements that will be required for program year 2019. So the objective for coordination of care is use certified electronic health record technology, otherwise known as CERT, to engage with patients or their authorized representatives about the patient's care. An EP must meet the minimum threshold for 2 of the 3 measures or meet one of the 2 available exclusions. The exclusions for all 3 measures are the same. If the EP meets one of the exclusions, the EP can meet the exclusion for all 3 measures. Okay, here are just possible combinations that are included below, just a few examples of what some EPs may meet and whether that's a pass or a fail. So as you can see, the headers are on that first row, and then the second row, which is the first example, it's showing that the EP is passing if they meet the threshold for measures 1 and 2, but they do not meet the threshold for measure 3, because they only have to meet a combination of 2 of the measures. However, the second example is going to walk through what happens if the example covers meeting 1 threshold, but taking the exclusion for measures 2 and 3. The EP is passing in that scenario because they're meeting that first threshold, and then they took the remaining exclusions because they could not meet the thresholds for measures 2 and 3. Another possible scenario is the third example, which also shows that EP is passing, where the EP takes the exclusion for all 3 measures. The last example is one that shows that the EP is failing. The EP in this scenario does not meet the threshold or exclusion for measures 1, 2, and 3. Some definition of terms that we will be using throughout this presentation. The first one is view, which means that the patient or authorized representative accessing their health information online. Download is the movement of information from online to physical electronic media. Transmission, this may be any means of electronic transmission according to any transport standards, which there's a few listed right there as examples. However, the relocation of physical electronic media, for example, a USB or CD, does not qualify as transmission. Some more definition of terms. The Application Programming Interface, otherwise known as API, a set of programming protocols established for multiple purposes. APIs may be enabled by a provider or provider organization to provide the patient with access to their health information through a third-party application with more flexibility than is often found in many current patient portals. Patient-generated health data is data generated by a patient or a patient's authorized representative. Data from a non-clinical setting. This includes, but is not limited to, social service data, data generated by a patient or a patient-authorized representative, advanced directives, medical device data, home health monitoring data, and fitness monitoring data. Secure message is any electronic communication between a provider and patient that ensures only those parties can access the communication. This electronic message could be an email or the electronic messaging function of a personal health record, PHR, an online patient portal, or any other electronic means. A unique patient is if a patient is seen by an EP more than once during the PI reporting period, then for purposes of measurement, that patient is only counted once in the denominator for the measure. So for example, if a patient came in twice within 1 month, that patient should only be counted as one when counting unique patients. All the measures relying on the term unique patient relate to what is contained in the patient's medical record. Coordination of care through patient engagement. In order to meet the objective, the following information must be available to the patient via CERT: the patient name, the provider's name and office contact information, the current and past problem list, procedures, laboratory test results, current medication list and medication history, current medication allergy list and medication allergy history, the vital signs, which a few of those examples are listed, the smoking status, the demographic information, the care plan fields, including goals and instructions, and any known care team members, including the primary care provider of record. An EP can make available additional information and still align with the objective. Okay, so objective 6, measure 1, because keep in mind there are 3 measures underneath this objective. Measure 1, more than 5% of all unique patients or their authorized representatives seen by the EP actively engage within the EHR made accessible by the EP and either view, download, or transmit to a third party their health information, or 2, access their health information through the use of an application programming interface that can be used by applications chosen by the patient and configured to the API in the EP CERT, or 3, which is a combination of 1 and 2. You can either use 1 or 2 or a combination of both. There are 4 patient-initiated actions that can be included in Measure 1. First one is view their information. The second one is download their information. The third is transmit their information to a third party. And the fourth is accessing their information through an API. These actions may overlap, but an EP is able to count the patient in the numerator if the patient takes any and all actions. They don't have to take all of them. They can just take one of them or a variety of them. An EP may meet a combined threshold for view, download, and transmit and API actions, or their technology functions overlap. Then any view, download, transmit, or API actions taken by the patient using CERT would count towards the threshold. To be included in the numerator, the action must occur within the calendar year in which the PI reporting period occurs. So what were the changes from modified stage 2 to stage 3? For measure 1, the meaningful use objective in program year 2018, which was modified stage 2, was objective 8, measure 2. However, for program year 2019, which this presentation is focusing on, it is now objective 6, measure 1. The stage did change from modified stage 2 to stage 3. And then the application programming interface item was added to program year 2019. So in 2018, API was not able to be used for modified stage 2 to help a provider meet the requirements. Now a patient has the option of using API to actively engage with a CERT and be included in the numerator, but it is not required. So what are the documentation requirements for measure 1? A CERT-generated dashboard report for the selected PI reporting period that shows the following: the provider's name, the numerator, the denominator, and the measure percentage. All 4 of these things must be showing on that dashboard report. In certain situations, a non-CERT-generated report may be necessary. The use of non-CERT-generated reports may be permitted upon access, review, and approval. Okay, so now let's move on to measure 2. For more than 5% of all unique patients seen by the EP during the PI reporting period, a secure message was sent using the electronic messaging function of the CERT to the patient, or in response to a secure message sent by the patient or their authorized representative. The numerator includes provider-initiated communications, which is when a provider sends a message to a patient or the patient's authorized representative, and provider-to-provider communications if the patient is included. So if one provider sends to another provider a secure communication and that patient is included on that email, that would count towards the numerator. However, to be included in the numerator, the action must occur within the calendar year, within the PI reporting period occurs. However, the patient must have been seen during that PI reporting period, that 90-day PI reporting period. But that secure message can be sent within the calendar year. An EP can only count messages in the numerator when the EP participates in the communication. Any patient-initiated communication only if the EP responds to the patient. So that patient can start the communication. EPs are not required to respond to every message received if no response is necessary. So what were the changes from modified stage 2 to stage 3? So in 2018, present year 2018, it was called Objective 9. Now, in 2019, it is Objective 6, Measure 2. And then the stages did change. So in 2018, it was Modified Stage 2, and now it is Stage 3 for Program Year 2019. What are the documentation requirements for Measure 2? Well, you would need to submit a CERT-generated dashboard for the selected PI reporting period that shows the following: the 4 items: provider's name, make sure that's included on the report. Make sure the numerator is included, the denominator, and the measure percentage. So make sure all 4 of those things are showing on that CERT-generated dashboard report for Measure 2. In certain situations, a non-CERT-generated report may be necessary. The use of non-CERT-generated reports may be permitted upon access review and approval. Okay, so now let's look at Measure 3 and what those requirements are. Okay, so it is a patient-generated health data or data from a non-clinical setting is incorporated into the CERT for more than 5% of all unique patients seen by the EP during the PI reporting period. The types of data that would satisfy the measure are broad. The data may not be information the patient provides to the EP during the office visit, as such data does not meet the intent of the measure to support care coordination and patient engagement in a wide range of settings outside the EP's immediate scope of practice. However, if a patient separately provides clinical information, including family health history, through other means, meaning not during the office visit, that information may count towards the numerator. Data related to billing, payment, or other insurance information would not satisfy this measure. Measure 3 does not specify the manner in which EPs are required to incorporate the data. EPs may work with their EHR developers to establish the methods and processes that work best for their practice and needs. Data may include, but is not limited to, social service data, data generated by a patient or a patient's authorized representative, advanced directives, medical device data, home health monitoring data, and fitness monitor data. In addition, the sources of data vary and may include mobile applications for tracking health and nutrition, home health devices with tracking capabilities, such as scales and blood pressure monitors, wearable devices such as activity trackers or heart monitors, patient-reported outcome data, and other methods of input for patient and non-clinical setting generated health data. For example, an Apple Watch that is connected with the patient's CERT. And as that data flows into the patient's CERT, the record inside the CERT, that would be an example of patient-generated data. Telehealth platform, personal health records, social determinants of health screening modules, long-term care, or post-acute care coordination platforms might also be considered. A non-clinical setting is defined as a setting with any provider who is not an EP as defined for the Medicare and Medicaid PI incentive programs, and where the care provider does not have shared access to the EP. Medicaid PI incentive program EP definition: an EP must be one of the following: 5 types of Medicaid professionals: physicians, dentists, certified nurse midwives, nurse practitioners, and physician assistants practicing in a federally qualified health center or a rural health center led by physician assistants. Providers in non-clinical settings may include, but are not limited to, care providers such as nutritionists, physical therapists, occupational therapists, psychologists, and home health care providers. Other key providers in the care team, such as behavioral health care providers, may also be included. And we encourage EPs to consider ways in which this measure can incorporate this essential information from the broader care team. Changes from modified stage 2 to stage 3 when it comes to that patient-generated data and non-clinical setting data. This was not a measure in 2018, so as you can see for the meaningful use objective, it was not in program of 2018. However, in 2019, it is objective 8, measure 3, and then for meaningful use stage, it was not in modified stage 2, but now it is in stage 3. So documentation requirements for measure 3. It needs to be a CERT-generated dashboard report for the selected PI reporting period that shows the following. There's 4 items, as discussed previously for the other measures: the provider name, the numerator, the denominator, and the measure percentage. The second requirement for this measure is to upload an explanation of what patient-generated health data is being utilized and how the CERT is capturing that data. Please keep in mind that additional documentation may be requested after review of the provider's methodology. And for that first CERT-generated dashboard report, there are certain situations where a non-CERT-generated report may be reviewed and approved by Access. Okay, so objective 6, exclusion. That's just some definition of terms for an exclusion. The EP is not required to submit data or meet the measure, but the EP must submit documentation of how he or she met the exclusion. The exclusion for objective 6 is the office visit criteria, which we'll discuss in detail, as well as the broadband criteria. Okay, so for measures 1, 2, and 3, an EP may take an exclusion for either measure or both if either of the following apply. The EP has no office visits during the PI reporting period, or the EP conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 4 megabytes per second broadband availability according to the latest information available from the Federal Communications Commission, the FCC, on the first day of the PI reporting period. Please keep in mind that EPs in Arizona are not able to meet this exclusion. So for programs 2015 and 2017, CMS identified the counties in the U.S. who conducted 50% or more patient encounters in a county where 50% or more of its housing units do not have 4 megabytes per second broadband availability and therefore meet the broadband exclusion. The state of Arizona does not have any counties listed. Therefore, an EP in Arizona is not able to meet this exclusion. CMS has not published an updated list of the counties. However, the majority of counties in the U.S. have increased their broadband availability and still do not meet the requirements for this exclusion. It is unlikely the broadband availability would have decreased since the CMS tip sheet was published. Therefore, all EPs should keep in mind in Arizona that they are not able to claim that exclusion. The link at the bottom of the screen would take you to that tip sheet that CMS put out regarding program years 2015 to 2017, listing the different counties. So what exclusion documentation is required? So for the first exclusion, which EP has no office visits during the PI reporting period, please keep in mind that this applies to all 3 measures and is available to EPs who meet this requirement. Those EPs must submit documentation supporting that all patients seen by the EP are conducted outside the office. For the broadband access exclusion sufficient documentation, the EP must show that they conduct 50% or more of the patient encounters in the eligible county. The county shows that 50% or more of its housing units do not have 4 megabytes per second broadband availability on the first day of the PI reporting period. The EP must support both of these items. They must show that they conducted 50% or more of the patient encounters in the eligible county. And the second requirement, they must show the county that they're working in shows that 50% or more of its housing units do not have 4 megabytes per second broadband availability on the first day of the reporting period. So what types of audit findings do we usually find, and what happens during an audit? So all providers that receive a Medicaid PI program incentive payment could potentially be selected by Access for post-payment audit. If selected, Access Post-Payment Analyst will conduct a thorough review of the documentation attached to the EP's attestation in EPIP to determine if the EP meets the program requirements. Access may have follow-up questions or make additional documentation requests. What are some common audit findings? One of them is that the CERT dashboard does not show the PI reporting period or EP name. Make sure when submitting that document that you are showing the reporting period as well as the EP name for program year 2019. The second finding that we usually find is the failure to maintain documentation, and the practice no longer has access to the CERT to pull that CERT dashboard report. The third item that we find common is including data for the entire practice in the CERT dashboard report rather than data for the individual EP. Keep in mind that this is an individual requirement that must be met by each EP attesting. And so the CERT dashboard should be pulled to only reflect the patient seen by the EP during the PI reporting period. The fourth common audit finding is not uploading the CERT dashboard during attestation. Make sure you go ahead and run that report for the individual and upload it to their attestation. Here are some of the resources that you can use as well as this webinar, the CMS Objective 6 tip sheet. And these are each hyperlinks that you can click on and it will bring up the website for where we found all the information. The second item is the federal final rule for modified stage 2 and stage 3. And the last item is the Access Coordination of Care through Patient Engagement, Frequently Asked Questions. And that's going to take you to the Access website where this webinar can be found, and also the Frequently Asked Questions document that we will go over at the end of this presentation if no one has any additional questions. Here are some contact information for any questions that you may have after this webinar is concluded. The first one is for Access, and it's for the PI program, so there is an email as well as a phone number that you can call to ask any questions or any additional information that you're looking for. The second item is for Health Current, their educational assistance and support. So there's also an email and phone number there if you have any questions and you want to reach out to them as well. So there are two different teams that you can reach out to for any questions that you may have. Okay, so now we're going to see what questions you may have for me that I can answer and help you all just help you understand the program better. So I'll hand it over to Sarah and Connie if they have any questions in the chat box.
Thank you, Priscilla. And again, if you have any questions, please include your organization name as well as whatever question you may have.
And while we're waiting for y'all to just put in any of those questions into the chat box, I'm going to go ahead and open up our frequently asked questions document that we prepared for today's presentation. And it may just we'll go through each of the questions and it may bring up some additional questions that you may have. So as I'm reading these questions, feel free to go ahead and type your question into the chat box. We want to answer your questions in the chat box first. So I'll go through a couple of these questions, and then if there's any, I'll pause just to see if there's any questions in the chat box. Okay, so the first question is, how does an eligible professional meet the coordination of care through patient engagement reporting objective? An EP must meet the minimum threshold for 2 of the 3 measures or meet 1 of the 2 available exclusions. The exclusion for all 3 measures are the same, and that's the out-of-office criteria and the broadband exclusion. So if the EP meets 1 of the exclusions, the EP can meet the exclusion for all 3 measures. Okay. Question 2. For Objective 6, Measure 1, the patient actively engages with the EHR and either views, downloads, or transmit to a third party their health information. So what does view, download, and transmit entail? View is the patient is able to access their health information online, or it can be their authorized representative. Download is information can be moved from online to physical electronic media. Transmit is the movement of information by any means of electronic transmission according to any transport standards, which are listed right there. However, the relocation of physical electronic media, for example, USB or a CD, does not qualify as transmission, so make sure it meets those standards. The third question is, what is an application programming interface, which we're going to call API? It is a set of programming protocols established for multiple purposes. APIs may be enabled by a provider or provider organization to provide the patient with access to their health information through a third-party application with more flexibility than is often found in many current patient portals. So what is a patient-generated health data? Patient-generated health data is data generated by a patient or a patient's authorized representative. So the fifth question, what is data from a non-clinical setting? That is, data from a non-clinical setting includes but is not limited to social service data, data generated by a patient or a patient's authorized representative, advanced directives, medical device data, home health monitoring data, and fitness monitor data. And as you can see, there's a link, and that will bring, if you click on that link, it will bring up the webinar presentation that was we just went through. Sarah, have any questions come through the chat box yet?
Not at this time.
Okay, thank you. So we'll continue. So question 6 is, what is a secure message? A secure message is any electronic communication between a provider and patient that ensures only those parties can access the communication. This electronic message could be email or the electronic messaging function of a personal health record, an online patient portal, or any other electronic means. Please keep in mind that even though it identifies that an email would count, it must be a secure email, which is why it's a secure message. So question 7, what is a unique patient? A unique patient is a patient who is seen by the NEP either once or more than once during a PI reporting period. For purposes of measure, the patient is counted once in the denominator for the measure. All the measures relying on the term unique patient relate to what is contained in the patient's medical record. Okay. Question 8, in order to meet the care coordination through patient engagement objective, what information must be available to the patient via the CERT? In order to meet the objective, the following information must be available to the patient via CERT: the patient name, the provider's name and office contact information, the current and past problem list, procedures, the laboratory test results, the current medication list and medication history, the current medication allergy list and medication allergy history, the vital signs, the smoking status of the patient, the demographic information, the care plan fields, including goals and instructions, and any known care team members, including the primary care provider of record. NEP may make available additional information and still align with the objective. So what patient-initiated actions can be included in the numerator for Objective 6, Measure 1? There are 4 patient-initiated actions that can be included in Measure 1. If the patient views their information, if the patient downloads their information, or third, transmits their information to a third party, or the patient accesses their information through an API. A patient does not need to complete all 4 actions. For example, a patient may only view his or her information and will still be included in the numerator. The actions may overlap, but an EP is able to count the patient in the numerator if the patient takes any and all actions. And Sarah, feel free to interrupt me if any questions come through the chat box.
Will do. I'd like to remind all of the group that there is a chat box that if you would like to ask a question, just include your name, organization, and what your question is.
Okay, so for question 10, when must the patient access their health information in order to be included in Objective 6, Measure 1, numerator? To be included in the numerator, at least one of the 4 patient-initiated actions, as described in the previous FAQ, must occur within the calendar year in which the PI reporting period occurs. For a patient to be included in the numerator, the patient must also be included in the denominator. The denominator includes all unique patients seen by the EP during the PI reporting period. Therefore, a patient had to have been seen by the EP during the reporting period to be included in the numerator. However, the patient does not have to have accessed his or her health information during the reporting period to be included in the numerator. Patients seen during the reporting period can access their health information at any point during the calendar year and still be included in the numerator. Please note each patient should only be counted once, even if the patient accessed his or her health information on multiple occasions. So what changes occurred between modified stage 2 for program year 2018 and stage 3 for program year 2019 for objective 6, measure 1? The following changes occurred between modified stage 2 and stage 3. First, the measure was formerly objective 8, measure 1 in program year 2018 for modified stage 2. It is now objective 6, measure 1 in program year 2019 for stage 3. 2, in addition to viewing, downloading, or transmitting health information, a patient who uses API to access his or her health information will be included in the numerator. Question 12. What documentation must be submitted to demonstrate that the EP meets Objective 6, Measure 1? The EP should submit a CERT-generated dashboard, and keep in mind that in certain situations, if Access reviews and approves a non-CERT-generated report, it can be potentially used. So the generated dashboard for the selected PI reporting period that shows the following: the provider's name, the numerator, the denominator, and the measure percentage. The dashboard must show all 4 items. Okay, so question 13, what unique patients are included in the numerator for Objective 6, Measure 2? The numerator includes unique patients who have provider-initiated communications, which is when a provider sends a message to a patient or the patient's authorized representative, and provider-to-provider communications if the patient is included. An EP can only count a patient who received messages in the numerator when the EP participates in the communication. For example, a patient-initiated communication only if the EP responds to the patient. The provider must respond. Question 14. When must the communication with a unique patient occur for a patient to be included in Objective 6, Measure 2 numerator? To be included in the numerator, the communication with the patient must occur within calendar year in which the PI reporting period occurs. So this is very similar to Measure 1. For a patient to be included in the numerator, the patient must also be included in the denominator. The denominator includes all unique patients seen by the EP during the reporting period. Therefore, a patient had to have been seen by the EP during the reporting period to be included in the numerator. However, a secure message does not have to be sent to the patient during the reporting period to be included in the numerator. Secure messages sent at any point during the calendar year to patients seen during the reporting period can be included in the numerator. Please note each patient should only be counted once, even if multiple messages were sent. So what changed between modified stage 2 and stage 3 in program year 2019 for Objective 6, Measure 2? The measure was formerly Objective 9 in program year 2018 for modified stage 2. It is now Objective 6, Measure 2 in program year 2019 for stage 3. There were no other changes for this measure. Question 16. What documentation must be submitted to demonstrate that the EP meets Objective 6, Measure 2? The EP should submit a CERT-generated dashboard for the selected reporting period that shows the following: the provider's name, the numerator, the denominator, and the measure percentage. In certain situations, a non-CERT-generated report may be necessary. The use of non-CERT-generated reports may be permitted upon Access review and approval. Please keep in mind for those 4 items: provider's name, the numerator, the denominator, and the measure percentage. Those last 3 items should be specific to that EP. It should not, the numerator and denominator should not include all patients at the practice. It should include the ones that the EP saw during the PI reporting period, and if they meet the requirements for that measure. Question 17, what patient-generated data for Objective 6, Measure 3 include patient information provided by the patient during the visit? The data cannot be information the patient provided to the EP during the office visit. However, if a patient separately provided clinical information, including family health history, through other means, so not during the office visit, that information will still count towards the numerator. So please keep in mind the data cannot be information the patient provided to the EP during the office visit. Question 18. What data related to billing, payment, or other insurance data be included as patient-generated data? No, the data related to billing, payment, or other insurance information cannot be included as patient-generated data. Question 2, what sources are available to provide patient-generated data from a non-clinical setting? The sources of data vary and may include mobile applications for tracking health and nutrition, home health devices with tracking capabilities such as scales and blood pressure monitors, wearable devices such as activity trackers or heart monitors, the patient-reported outcome data, and other methods of input for patient and non-clinical setting generated health data. Telehealth platform, personal health records, social determinants of health screening modules, long-term care or post-acute care coordination platforms might also be considered. Question 20, is data downloaded from a patient's glucometer device considered patient-generated health data? Yes, the data downloaded from a patient's glucometer device would be considered patient-generated health data and would count towards the numerator if the data is generated outside the office visit. Because as discussed previously, for the numerator, the data cannot be given during the office visit. It must be outside the office visit. Question 21, how is the EP required to incorporate the patient-generated data into the CERT? Measure 3 does not specify the manner in which EPs are required to incorporate the data. EPs may work with their CERT developers to establish the methods and processes that work best for their practice and needs. Question 22, what is considered a non-clinical setting? A non-clinical setting is defined as a setting with any provider who is not an EP as defined for the Medicaid PI incentive program and where the care provider does not have shared access to the EP. Providers in non-clinical settings may include, but are not limited to, nutritionists, physical therapists, occupational therapists, psychologists, and home health care providers. Other key providers in the care team, such as behavioral health care providers, may also be included, and CMS encourages EPs to consider ways in which this measure can incorporate this essential information from the broader care team. What is the definition for an EP in the Medicaid PI incentive program? The answer to that question is an EP in the Medicaid PI incentive program must be one of the following 5 types of Medicaid professionals: physicians, dentists, a certified nurse midwife, a nurse practitioner, and physician assistants practicing in a federally qualified health center or a rural health center led by a physician assistant. Question 24. What changed between modified stage 2 in program year 2018 and stage 3 for program year 2019 for objective 6, measure 3? This is a new measure for program year 2019, stage 3. Question 25. What documentation must be submitted to demonstrate that the EP meets Objective 6, Measure 3? The EP should submit a CERT-generated dashboard for the selected PI reporting period that shows the following: the provider's name, the numerator, the denominator, and the measured percentage. As discussed previously, please keep in mind that the numerator, denominator, and measured percentage should be specific and specifically related to that specific provider. Okay, make sure to upload an explanation of what patient-generated health data is being utilized and how the CERT is capturing that data. Additional information may be requested after review of the provider's methodology. In certain situations, a non-CERT generated report may be necessary. The use of non-CERT generated reports may be permitted upon access review and approval. Question 26. Are the exclusions for Objective 6 measures 1, 2, and 3 the same? Yes, an EP may take an exclusion for one or both measures if any of the following apply. The first exclusion is that the EP has no office visits during the PI reporting period. The second exclusion is that the EP conducts 50% or more of his or her patient encounters in a county that does not have 50% or more of its housing units with 4 megabytes per second broadband availability, according to the latest information available from the Federal Communications Commission on the first day of the PI reporting period. As discussed during this webinar, this exclusion is not applicable to EPs in Arizona. Question 27. Where do I find the latest information available from the Federal Communications Commission? If the EP is interested in additional information from the FCC regarding broadband information, the EP can visit the FCC website. As shown, this is a link that will take you to the FCC website. Any documentation that might be used by the EP to support meeting the exclusion must be supported by the format 4/1 megabytes per second. The 4 stands for the 4 and the 1. They each stand for, 1 stands for the upload speed and 1 stands for the download speed. And it cannot be 25/3 megabytes per second. The state recommends that the EP uses the Broadband Access Exclusion Tip Sheet from CMS to determine if the EP is in a county that is eligible for the exclusion. The state of Arizona does not have any counties listed, therefore an EP in Arizona is not able to meet this exclusion. That does conclude all of the questions that we have prepared for today's presentation. If you have any last-minute questions, please make sure to put that in the chat box. And as discussed previously, we do have the contact slide. Just containing the contact information if you do have questions after this presentation is concluded. Sarah, are there any other questions in the chat box?
No, there are currently no questions in the chat box.
Okay, thank you. So again, if y'all have any questions, it looks like we'll be ending today's presentation early, but if y'all have any questions after this presentation or once you come back and re-review these slides and questions, please feel free to reach out to either the emails or the phone numbers listed on this slide.
Well, thank you, Priscilla. I appreciate you going through this. For everyone who's registered for today's webinar, you're going to receive a copy of the webinar slide deck and the questions and answers addressed in the call. So this call has been recorded and will be posted along with the FAQs to the Health Current and Access websites. This concludes today's webinar, and thank you, Access, for the presentation today, and thanks to all of you for participating. Have a wonderful rest of your day. Thank you.